Hello and welcome to your MedLife Mobile Clinic Guide. Here you will find instructions on how to make sure that your mobile clinic's experience runs smoothly. Please pay close attention to all of the points mentioned in this guide. A MedLife Mobile Clinic consists of 7 different stations: vitals, education, general medicine, dental, OBGYN, pharmacy, and toothbrushing. Upon arrival to the community that we will be working with, you must coordinate with the representatives of that community regarding how to set up the clinic, which includes but is not limited to the locations of tents, the number of chairs and tables that will be needed, etc. Each community and their facilities are different, but we must look for certain criteria when selecting examination rooms. Please remember to follow these recommendations. For vitals, this does not require a closed space, but needs to be located before the other stations, as this is where patients will go first for check-in. Remember that there can be long lines of patients, so look for a fairly big, open space. Education. This must be located between vitals and the other stations. Remember that this station works as an educational workshop and a waiting room, so a large room with open doors or a big tent with plenty of chairs will be needed. If it is decided to use video materials, remember that you need to hang the screen in a sturdy place with low light to be able to display it correctly. General medicine and dental. Ideally, the stations will be in separate and closed rooms. If the community does not have closed rooms available, tents can be used, but remember that doctors must maintain distance between each other for patient privacy. The dental station can never be outdoors, as the instruments must remain clean and free of dust and dirt. OBGYN. This must be set up in a closed room. If you do not find a sufficiently private setting, you can use the tents, but make sure that no one can see inside or easily enter. Pharmacy. You do not need a closed environment, but depending on the location, you may need a tent. This station is the last one that patients will pass through and should be close to the exit. Toothbrushing. You need an outdoor environment that is away from all other stations. We recommend setting this up slightly outside the principal clinic location to attract the attention of passerby. This station may also require a tent. Now we will describe how to run each station during a mobile clinic. Vitals. The vital station will be run by a nurse or a nursing assistant who is qualified to perform triage and has knowledge of the local language. You must use the registration forms for children and adults, which contain all of the patient contact information. The forms must be numbered according to the order of arrival. Remember that the data in these records must be accurate so we can deliver pap smear and breast exam results. A volunteer may help fill out the registration forms if he or she speaks the local language. Glucose exams may be performed, but only by the authorized nurse. To take the vitals, volunteers will use thermometers, blood pressure meters, scales, and a tape measure. They will dictate the results to the nurse. After finishing registration and vitals, patients will go to the education station with their registration form. Education. It is mandatory that all patients go to the education station. The education station will be run by a nurse or technician to discuss issues such as nutrition, breast and cervical cancer, cholesterol, etc. Nurses will need the informational flyers and brochures, as well as educational videos if available. Volunteers will distribute informational flyers, help maintain the order of the patients, and take them to the general medicine station when it is their turn. Do not forget to stamp the record of each patient that has passed through the education station. General medicine, dental, and OBGYN. These stations should be led by doctors who speak the local language as well as English in order to explain what is happening to the students. Volunteers will shadow the doctors and help however is needed. To avoid interrupting the patient, the explanation and translation should be given after the consult is over. At the dental station, students will help by filling out dental records, passing out materials, and holding the flashlight and suction device during the procedure. At the OB/GYN station, the doctor and volunteers should be female to make patients feel more comfortable. Patients treated at this station may have several health concerns, but all should be offered a pap smear and breast examination. Pharmacy. After passing through all necessary stations, patients will head to the pharmacy to fill necessary prescriptions and hand in their registration form. The pharmacy station is run by a local nurse. Remember that only patients who have completed all necessary stations can pass through the pharmacy, as this is where their registration form will be collected for our records. Volunteers will help by preparing the prescriptions for each patient under the guidance of the nurse, such as counting pills. The nurse must also carefully explain to the patients how to take their medications. Toothbrushing. The toothbrushing station does not need to be supervised by a staff member if no one is available, but volunteers must be trained. Only children between the ages of 3 and 12 years old can participate. The ideal group size is 5 children at a time. Volunteers will first give a free toothbrush to each child and teach them how to brush their teeth. Children will spit the toothpaste into a bucket. These buckets must be sterilized. After the children brush their teeth, the volunteers will apply fluoride and instruct the children not to eat or drink anything for the next hour. Rules and recommendations. All medicines are for patients of the MEDLIFE mobile clinic and cannot be distributed without a prescription or professional recommendation. Children will not be attended unless they are accompanied by an adult. Dental instruments must be washed and sterilized at the end of each mobile clinic day, with the help of volunteers. Volunteers may eat lunch in shifts after they have rotated to their second station at 12 p.m. Once the clinic is finished, you must coordinate with the volunteers to pack up all of the materials. Everything must be packed carefully and stored in its proper place.